Maybe we can begin, as I did with the introductions, with John Williams.
Oh, joy. He's doing it first.
Unless, John, you want to pass the baton to someone else.
It's always good to go first. First of all, I'd like to thank Warren and CPMC for inviting me to participate as a panel member here. Next, I have a small confession to make. Prior to joining NEMS, I really didn't know what a community health center was or who they served. But for over 30 years, clinics and community health centers have been functioning quietly without fanfare, day in and day out, as the city's safety net provider, looking out for the health and well-being of the medically underserved population in our city. I do feel a little blessed in terms of having, I think, near perfect timing in terms of joining the Community Health Center family here in San Francisco. It does appear that we are on the verge of providing health care or health insurance coverage for all Americans in our country. But simply having health insurance does not necessarily guarantee access, nor does it guarantee the quality of care that you'll be provided. As I stated, although clinics and CHCs have been around for more than 30 years, they do not and they cannot function alone. Organizations such as CPMC, San Francisco Department of Health, and Kaiser Permanente, through grants, partnerships, and programs such as Healthy San Franciscan, play an integral part in the city's safety net. Their support, both financially and clinically over the years, has brought us to a point where community health centers are no longer simply an afterthought, but are now considered key stakeholders in healthcare reform. If I could take just a few more minutes of your time and tell you a quick story. Last August in 2008, a patient came to one of our NEMS clinics complaining of some vague stomach pains. On a subsequent follow-up visit in September, the patient showed no signs of improvement and was referred to a GI specialist at NEMS, who ended up recommending additional tests. In October, a colonoscopy was scheduled and conducted at CPMC that unfortunately revealed colon cancer. The surgery was scheduled and completed at CPMC in November of 2008. And I'm proud to tell you today that the patient is doing well, cancer-free, and if you realize that that timeline was only 3 months from initial complaint to a successful surgery. Now, without this safety net partnership, who knows how this story would have developed or how the story would have ended. It says, I'm now part of and believe in a healthcare community that 8 months ago I did not know existed. I believe that this is what healthcare is meant to be, that the model for healthcare reform will be based on safety net partnerships both in this city and across the country. Thank you for your time.